Part 2 of Unit 3 is Objective 38, Identify Critical Stages of Development of Various Organs. First, we're going to talk about the placental membranes. The placental membranes are made up of the chorion and the amnion. The chorion is the outer cell membrane, and it develops from the trophoblast and will become the fetal side of the placenta, and it's very smooth and shiny. The amnion is the inner cell membrane. It develops from the blastocyst and becomes the covering of the umbilical cord. Together with the chorion, the amnion and the chorion together make the amniotic sac. Amniotic fluid, some terms you need to know with amniotic fluid. Oligohydramnios, which is less than 300 milliliters of amniotic fluid. It is associated with renal abnormalities. Polyhydramnios, or hydramnios, is more than 2 liters of amniotic fluid at delivery, and it is associated with GI abnormalities. Normal amount of amniotic fluid is 1 liter. During the first trimester, amniotic fluid is produced from the amniotic membrane. During the second and third trimesters, the majority of amniotic fluid is produced by the fetal kidneys. Amniotic fluid consists of water and protein, carbohydrates, lipids, electrolytes, fetal cells, lanugo, which is the fine downy hair that covers the fetus, and verx caseosa, which is the cheese-like substance that also covers the baby, the developing fetus in utero. Normally, amniotic fluid should be very clear in coloration to a very pale straw yellow color. There are many functions of the amniotic fluid. They include acting as a cushion, preventing adherence of the embryo to the amniotic membranes, allowing freedom of fetal movement for symmetrical growth, and providing a constant thermal environment. The yolk sac functions only during embryonic life. It initiates the production of red blood cells until the embryonic liver can take over. It will degenerate after about 6 weeks and be encompassed by the umbilical cord. The umbilical cord has 2 arteries and 1 vein, and you should know the acronym AVA. The arteries carry deoxygenated blood, and the vein carries oxygenated blood to the fetus. The umbilical cord has Wharton's jelly in it. Wharton's jelly is a connective tissue that prevents compression of the blood vessels of the umbilical cord. Sometimes the umbilical cord can be wrapped around the fetal neck or around a body part. At that point, it is called a nuchal cord. And a nuchal cord occurs when the umbilical cord is wrapped around wrapped around the fetal neck. Here are just some pictures of the developing embryo. You can see right here that we have implantation complete. We have the chorion and the chorionic villi going into the endometrium. Here we have the yolk sac and the developing embryo. In this picture, we have separation of the amnion and the chorion from the placenta, the amniotic membranes. In this picture right here, you can see the one large umbilical vein, and you can see one kind of grayish umbilical artery associated with that. In this picture here, you can see the umbilical cord stump following delivery. You've got 2 arteries and 1 flat vein. The placenta is made up of between 15 and 20 cotyledons. It has both endocrine and metabolic functions. The placenta is a site of metabolic and gas exchange to the fetus and maternal blood, which is typically separated by only a single layer of cells. The placenta produces 4 hormones: progesterone, which facilitates implantation and decreases uterine contractility; human chorionic gonadotropin, or HCG, which stimulates the corpus luteum of the ovary to continue to secrete estrogen and progesterone until the placenta can take over, which is about 13 weeks gestation; estrogen, which stimulates enlargement of the uterus and breast; and HPL, which is known as human placental lactogen, or as it's known now, HCS, which is human chorionic somatomammotropin. HCS or HPL stimulates fetal growth by regulating glucose and also stimulates breast development in the mom. These are just some pictures of placental sites. You can see here where the umbilical cord is inserted into the placenta and how the artery and the veins go out and extend out to the amniotic sac border but not beyond it. In this picture, you can see all the different cotyledons of the maternal side of the placenta, and this is the maternal side of the placenta here. It looks like a beefy red substance. In here you can see the fetal side of the placenta. We know it's the fetal side of the placenta because we can see where the umbilical cord is inserted. And again, this would be the fetal side of the placenta. Age of viability. By Iowa law, this is 20 weeks gestation, but with modern technology, the age of viability is typically between 22 and 25 weeks gestation. Age of viability is based on the central nervous system functioning and the oxygenation capacity of the lungs. The age of viability is the age at which the fetus can survive outside of the uterus and maintain life on its own. Obviously, at 20 weeks gestation, these preterm babies would need to have multiple life support systems on board in order to maintain life. Probably a ventilator, IV fluids, TPN, feeding supplementation, all that would be needed in order for a pretermer to survive. Blood circulation in the fetus is different than that in an adult. With fetal circulation, there are 3 shunts that are used. The 3 shunts are the ductus venosus, the foramen ovale, and the ductus arteriosus. The ductus venosus bypasses the liver and dumps blood directly into the inferior vena cava. This allows the majority of the high levels of oxygenated blood to enter into the right atrium. The ductus venosus closes functionally when the cord is clamped by the physician delivering. The foramen ovale connects the right atrium to the left atrium, so it shunts blood from the fetal lungs and so it can go into systemic circulation. This will close functionally at around 2 hours of life. The ductus arteriosus connects the pulmonary artery with the descending aorta, again shunting blood away from the fetal lungs, and it usually closes functionally about 15 hours of life. As you can see, it is normal for a newborn to have a murmur for the first 24 hours of life. Any murmur that lasts beyond 24 hours does need to be brought to the physician's attention so that they can get it evaluated. Here's just a picture of the shunts. Again, we have the 1 shunt here, the ductus venosus. We have the shunt in the heart, the foramen ovale, and then we have the shunt between the pulmonary artery and the descending aorta, which is the ductus arteriosus. Again, here's just another picture representing the difference between fetal circulation and neonatal circulation. Again, the ductus venosus, the foramen ovale, and the ductus arteriosus. When the cord is clamped, the ductus venosus constricts, the foramen ovale closes, and the ductus arteriosus constricts, because now we do need oxygen going to the lungs because the baby needs to oxygenate its blood itself. Another characteristic of fetal circulation, it allows it to have sufficient oxygen from maternal blood. There are 3 major characteristics of the fetus which allows it to obtain sufficient oxygen from maternal blood. 1, fetal hemoglobin has a 20 to 30% higher affinity for, not from, oxygen than maternal hemoglobin, meaning the fetal hemoglobin is more likely to pull oxygen off of the maternal hemoglobin. The fetal hemoglobin concentration is also about 50% greater than maternal concentration. So not only do they have a higher affinity, they have more oxygen carrying capacity with the increase in hemoglobin. And the fetal heart rate is 110 to 160 beats per minute. So the cardiac output of a fetus is greater than that of an adult. This was discussed in class in small groups to discuss the importance of fetal developments in these various systems. It's important that you know the highlights of each one of these systems that is important in fetal development. For example, with the respiratory system, the surges of surfactant between 24 and 26 weeks and 34 and 36 weeks, which allows the alveoli to maintain an open position instead of collapsing on themselves, is something that is important to know. The cardiovascular system, which kind of goes into the hematopoietic system, it is important to know when the blood is then initiated from the liver and the bone marrow, and also that the heart of a embryo begins to beat at about 4 weeks gestation. And these are just some pictures of prenatal development. As you can see here, day 1 starts at fertilization. We have the zygote, we have morula, early blastocyst, late blastocyst, implantation occurring between 6 to 7 days post fertilization. You can see the implantation continues until about 2 weeks out, where we have the formation of the embryonic disc. Then again, with the first menstrual period, we already have the primitive streak forming. From the primitive streak, we have the germ layers. The germ layers quickly develop into things that begin to look like a embryo. At this stage, in this 3rd week post-fertilization, we're still not sure if it's a human, a monkey, a cat, what it is. But you can see here on day 22 after conception, 4 weeks, we have the heart that begins to beat, and that is important because we do have heartbeat at that time, and that can be seen on ultrasound. Here we've got the optic pic forming in the 4th week. We've got the upper and lower limb bones starting to form. In the 5th week, we've got the eye and the nasal pits developing with a primitive mouth. Here we have the external acoustic meatus being formed, which is the ear. Eyelids begin forming about 7 weeks post-conception. Still not sure if it's a boy or a girl at this point. We really won't know if it's a boy or girl for another 2 weeks. And again, if you look at the 9th week, what it makes a girl and what makes a boy is so very similar. It's very hard to determine which is which. At this stage, these babies are very fragile. They need to be handled with care, especially if there is a miscarriage or stillbirth. And they are very red and gelatinous and very floppy. There's not muscle tone to them, so it's very important to be very careful when you handle these miscarriages if you would have one during an acute care state.